is Samantha and I'm a physiotherapist with a special interest in women's health. I'm also a pelvic health trained physiotherapist. And today I thought I would discuss what is a pelvic health physiotherapist and how it might be relevant to you during menopause. So a pelvic health physiotherapist is a physio who has done additional postgraduate training in this area, and they specialize in the assessment and treatment of conditions related to pelvic floor muscle dysfunction and the associated structures. The pelvic floor muscles are like a hammock-shaped muscle that supports your organs, so it supports your rectum, your uterus, and your bladder, and it is essential in maintaining continence, in sexual function, and in core stability. During menopause, there are a few common things that we see, and one of them is dyspareunia, which is pain with intercourse. And this is frequently because of the decreased estrogen that results in vaginal dryness and atrophy. So seeing your doctor and getting a topical estrogen cream might be very helpful in the management of this, as can a really good lubricant. But if those fail, you might have developed protective muscle spasm due to the pain, and then seeing a pelvic health physio can help to release that. Another thing that we see quite often is urgency or an overactive bladder. This can sometimes be a result of recurrent UTIs, and it often feels like you've got a UTI. So definitely, if you've got any UTI symptoms, you need to first go and see your doctor and find out whether you do or don't have one. If they've tested and it's clear, then see a pelvic health physiotherapist. We use bladder diaries and exercises and give you advice on how to normalize that bladder function again. And then the other really common one is incontinence, specifically stress urinary incontinence. This is when with an increase in intra-abdominal pressure, you leak urine. So with coughing, sneezing, exercising, lifting up something heavy. And this we are very effective in helping. We are very good at strengthening the pelvic floor muscles, but it is a little bit more complex than just simply what's happening in the pelvic floor. So I thought I would go into this in a little bit more detail. This is an anatomical picture of a bladder. So this is the bladder, and it's made out of a muscle called the detrusor, and this here is the bladder neck. This is the internal urethral sphincter, and this is the external urethral sphincter. And what I want to draw your attention to is the fact that there's multiple systems that keep us continent. And so sometimes, even if one doesn't work so good, the others can compensate. So one of the important ones is the connection between our brain and our bladder. So the bladder knows that when it's filling up with urine, the muscle needs to relax, and when it's time to empty the bladder, it can contract. Another important one is within the bladder neck, there is something called the lumen. And the lumen creates a natural seal. So this over here creates a natural seal within that bladder neck. And what happens during menopause is that because the estrogen levels decrease, the moisture decreases in the tissues, including this lumen, as well as a decrease in flexibility of the tissues. And this can result in a less efficient seal, naturally helping you to stay continent. So this could be why you've been continent your whole life and suddenly during menopause it's changed. It's that there's this natural seal that's gone away. And you could speak to your doctor and have a try to see if going on topical estrogen cream is going to help you, and maybe that will resolve the continent issue. Another thing that the estrogen does is we obviously know that the pelvic floor is the other very important thing that keeps us continent. And because of the decrease in estrogen, there's also a loss of elasticity and strength and muscle tone in the pelvic area. And so this might also be something that was a bit stronger and more capable, and now we need to work and strengthen it. So sometimes it's a combination of these two things that have been affected. And as a pelvic physio, we can obviously work a lot on strengthening that pelvic floor so that it is more capable of keeping the urine in and keeping you continent. Thank you so much for listening to the end of this video. I really hope you found it helpful. And if you are curious about any of the conditions that I went through or anything about a pelvic health physio, please feel free to contact us.